Let's do this.
Okay, buckle up, buttercups, because we're diving into the stuff nobody likes to talk about, but everybody needs to hear. This isn't your grandma's gentle health pamphlet. This is the real deal, no BS guide to spotting cancer signs. Inspired by a doc who's seen it all and is sick of the internet quacks. The main squeeze. Spot it early, kick its ass. First off, 95% of cancers are treatable if you catch the sneaky bastards early, but early means you gotta know what to look for. So let's get down and dirty with the signs. And no, reading this doesn't mean you have cancer, but ignoring these could be like playing Russian roulette with a fully loaded 4.4 Magnum. The where'd my ass go weight loss. You're dropping pounds like crazy, 5, 10, 15 pounds a month, and you're not on some new fad diet or sweating it out like a maniac at the gym. You've been living your normal, donut-filled life for 20, 30 years, and suddenly you're shrinking? That's your body screaming that it's spending energy on something major, like fighting an internal saboteur. Analogy. Imagine your body's a car. If it's suddenly guzzling gas like a Hummer when you're only driving it like a Prius, something's seriously wrong under the hood. Not to be confused with stress, divorce, job loss, that'll make anyone shed pounds, or a bad bout of food poisoning where everything exits faster than a politician at a subpoena serving. The I need a nap constantly fatigue. This isn't just I'm tired from a long day. This is bone-deep, soul-crushing exhaustion where you can barely drag yourself out of bed even after 10 hours of sleep. You used to crush your workload, now you need a nap after reading emails. Why? Your body is waging an all-out war against rogue cells. That takes resources, man. Often your iron tanks drop, hemoglobin drops, and boom, anemia, making you feel like a deflated balloon. Harsh truth, if your get up and go got up and went, and it ain't coming back, don't just chug more coffee. Lumps, bumps, and what the hell is that? Anywhere. Found a new weird lump or swelling, especially if it's hard, painless, and doesn't move around like a friendly little cyst, more like it's dug in and made itself at home. The doctor story, paraphrased. This doc saw a young guy with a lump on his arm big as a fist. He ignored it for months, thinking it was a bruise. By the time he got serious, it was too late. Don't be that guy. Skin. Moles changing color, size, shape, getting crusty, or just looking plain freaky, especially after you've baked yourself in the sun like a rotisserie chicken. Testicles. Listen up, gents. You got hands. Use them. When you're in the shower, give your boys a feel. Any new lumps, weird heaviness, or changes? Don't be shy. It could be a cyst, sure, but it could also be something that needs evicting stat. Women would kill for that kind of easy access to check their ovaries. The am I pregnant abdominal swell, especially for the ladies. Your belly suddenly balloons up like you swallowed a watermelon, but you're definitely not pregnant. And here's the kicker. Your arms and legs might even be getting thinner. This isn't just holiday weight. It could be fluid, ascites building up, often a sign of ovarian cancer. Analogy. It's like your abdominal is a leaky boat taking on water, and the rest of you is the shrinking shoreline. Swollen lymph nodes, your body's warning flares. Think of lymph nodes as your body's border patrol stations. If they're swollen, hard, painless, and stuck in one spot, neck, armpits, groin, or common, it means they're fighting something nasty and possibly losing. Don't confuse with tender, swollen glands from a sore throat or a cut. Those are usually your immune system winning a local skirmish. We're talking about the silent, stubborn ones. Headaches from hell and freaky sensory stuff. New, persistent headaches. Not your usual tension headache. These are regular, nasty headaches that have you popping painkillers like candy. Sudden hearing or vision loss, especially if it's just one ear or one eye, or, and this is a big one, If one eye starts doing its own thing, looking in a different direction. Why? Something in your brain might be pressing on the control panel for these functions. Get an MRI like yesterday. The human radiator fever. A low-grade fever, think 99.5 to 104 degrees Fahrenheit, or 37.5 to 38 degrees Celsius, that just lingers for weeks. Your body's thermostat is stuck on fight mode because something's constantly pissing it off. Doctor's horror story. Patient had a persistent low fever. Docs kept throwing antibiotics and fever reducers at her for a year. Turned out to be late-stage kidney cancer. A simple ultrasound early on could have changed everything. Unexplained leaks. Blood where it shouldn't be. Peeing blood. Pink, red, or even cola-colored urine. Could be a kidney stone, sure, but could also be bladder or kidney cancer. Look for worm-shaped clots. That often means it's coming from higher up, kidneys. Bloody or black tarry stool. Don't just blame hemorrhoids. It could be, but get it checked by a proctologist. Coughing up blood. Any weird vaginal bleeding or discharge? Ladies, you know what's normal for you. Toilet troubles, bowel and bladder going rogue. Persistent constipation or diarrhea. Stool changes. If your stool suddenly looks like pencil shavings or ribbons, it means something might be squeezing the exit ramp in your colon. Constant bloating and gas, like you've got a permanent air biscuit factory in your gut. Could be a partial blockage. Pain or difficulty urinating. The Darth Vader cough and breathlessness. A cough that just won't quit, or suddenly you're gasping for air after climbing a few stairs when you used to be fine. Could be a new tenant in your lungs making its presence known. The bottom line, don't be a hero, don't be an ostrich. One weird symptom for a day? Probably nothing. A combo of these, or any single one that's persistent and unexplained, that's your cue to see a real doctor, not Dr. Google. Don't blindly order tests. Tumor markers are complex. Let a doc figure out if you even need them and what they mean. Screenings save lives. Colonoscopies after 40, 45, or earlier if you're high risk. Mammograms, pap smears, they're not fun, but they're a hell of a lot better than late-stage cancer. Be a mate. See these signs in a friend or family member who's being stubborn? Gently, or not so gently, nudge them to get checked. You could save their life. Your body is usually pretty good at telling you when shit's hitting the fan. Your job is to listen, not stick your head in the sand. Knowledge is power. Now go live your life, but keep your eyes open.